Good day, I'm Nasal from BSN2B, and for today I will be doing the oxygen administration via nasal cannula to my client. Now the purposes of this procedure is first to deliver a low concentration or amount of oxygen when a minimal oxygen support is required for a client, and lastly to allow uninterrupted delivery of oxygen when the client ingests food or fluids. So following the nursing process, I will do an assessment. So I will be checking the skin and the mucous membrane color of my client. I will also be checking the breathing patterns and the chest movements. So also I will be checking the chest wall configuration, and then I will also listen to the lung sounds of my client. So I will use a stethoscope to auscultate. And then also I will be checking for any presence of clinical symptoms of hypoxia and hypercarbia. After assessment, I will now do the planning, in which I will be preparing and assembling all the equipments I will be needing. So I will need an oxygen tank with a flow meter and an adapter, and also a humidifier bottle, and with distilled water or tap water depending on the doctor's order or the agency rules. Also, I will have the nasal cannula and the tubing, and also a tape. It is optional, so you can use it if the nasal cannula and the tubing doesn't stay on the client's nares. And then after that, I will now proceed to the implementation. So I will be checking the need for the oxygen therapy, and I will also verify the doctor's order for the need of the therapy. So let me just double check it. So it states here that the doctor ordered to administer an oxygen by nasal cannula for my client. And then after that, I will be assisting my client to a semi-Fowler's position if possible. And also I will be explaining to my client that the oxygen therapy is not dangerous as long as the safety precautions is observed. So, good day, ma'am. Let me just assist you to a semi-Fowler's position. Okay. Okay po. Okay, ma'am. So, today po, I will be giving you an oxygen therapy, and this is not dangerous as long as you will be observing proper safety measures. So, we have here a no smoking sign. So let me just remind you that no one in this room should smoke. Also, avoid having fire, lighting up candles and such for your safety. Will that be okay? Okay, thank you. And then after that, prior to doing the administration of oxygen, I will be introducing myself and identifying my patient and verify my client's identity. Explain the procedure, why is it necessary, and how the client can cooperate during the procedure. Also, I will be explaining to the client the purposes and the benefits of oxygen therapy in planning future care for the client. So, good day, ma'am. I'm Nasal, your student nurse for today. May I know your name? Okay, ma'am. How about your age po? Okay, good. So, today po, I will be administering oxygen via nasal cannula. So this is to provide you a easier breathing, also to deliver a low amount of or concentration of oxygen, because you need a minimum oxygen support. Will that be okay? Okay, ma'am, thank you. Let me just double check that you already signed a written consent for this procedure. Am I right? Okay, ma'am. So Oxygen therapy will help you or will give you more comfort and help you in breathing. And let me know if you are feeling any discomfort or any reactions once the oxygen is administered on you. Will that be okay, ma'am? Okay, ma'am, thank you. And then after that, I will now performing hand hygiene, and I will observe other appropriate infection control procedure. Also, I will be providing privacy for my clients, so I will be closing the curtains around the bed and I will close the door of the room. And then after that, I will now assemble all the equipments that I will be using for this procedure. So we have here the oxygen tank. So I will attach the flow meter to the tank or to the wall outlet, and the position of the flow meter should be off. And then after that, if needed, I will fill the humidifier bottle with some solution or water. And then after that, I will attach the humidifier bottle at the base of the flow meter, and then I will attach the prescribed oxygen delivery device and the tubing to the humidifier bottle. So let me just attach it. And then I will attach the oxygen delivery device into the humidifier bottle. So now the equipments and the oxygen, the flow meter, the humidifier bottle, and the tubing is now assembled and prepared. I will now be turning on the oxygen at the prescribed rate, and I will check if it is working or functioning well. So let me just turn it on to a prescribed rate. And I will inspect if the oxygen is flowing appropriately to the tubing. So it is good, and there should be no kinks, and the oxygen tubing should be airtight, and there should be some bubbles when the oxygen is already flowing to the humidifier bottle. So there is bubbles. And then now I will put on or apply the prescribed oxygen delivery device to my client. So I will be placing over this cannula to the client's face. So I will the outleaf prongs or these things, I will fit it into the nares, and then I will hook the tubing to the ears of my client. And then if the nasal cannula or the tubing does not stay, I will use a tape for it to be fixed. Right. Now the nasal cannula is within the client's nares, so the oxygen is already administered. We should always remember to assess our client regularly. So we should check for the client's nares for any irritation or dryness, and if there is presence of dryness or irritation, we can use or put on some water-soluble lubricant to moisten and to avoid dryness of the mucous membrane. We should also check behind the ears for any irritation or discomfort that may caused by the tubing, and if it is present, we can pad it with gauze to relieve discomfort. Also, we should check the equipment on a regular basis. So we will check for the liter flow and the water level of the humidifier. to be sure that the water is not collecting in the dependent loops of the tubing, and we should do it, or we should check the equipment on a regular basis for every 30 minutes or when providing nursing care. And then after that, we will now document all the findings on the client records using forms and supplemented by narrative notes or forms if it is applicable. And for the evaluation, we will record any findings that deviate from normal and perform follow-up, and we should relate the findings if there is any prior data available. Also, we should report the findings that deviate from normal to the primary care provider, and we should always ensure that the patient is comfortable. So that's all for the oxygen administration. Thank you.